We know that courts in Colorado too. Indiana, okay, so we've got a couple of different, we've got some various places in the U.S. to look at. Louisiana, I knew Misty was in Louisiana. You really like this topic, Meg? All right, guys. And good morning, JoJo. Out of anybody in this room, has anyone ever delayed medical procedures due to the cost of healthcare? If so, just hands up, thumbs up in the chat, yes in the chat. Just, has anyone delayed medical procedures just based on the cost? Whether it be elective or necessity. Layla, yes. Meg, Ann. So it's not just a single state issue. As you can see, you guys are spread from one side of the United States to the other. And all of us have had to delay a medical procedure based on cost. Had to take a loan out for your daughter's surgery. Haven't, but have been close to having to. Okay, so let's talk about what the word inadequate means when I talk about healthcare in America. Access. Can you see a doctor when you need to? Affordability. Can you pay without going into debt? Outcomes. Are people actually healthy and living longer? So when I discuss inadequate healthcare in the United States, I'm discussing access, affordability, and outcomes. Today we're going to compare the U.S. with peers like Canada, the UK, Germany, France, Japan, Australia, and the North. We're going to bust myths, hear your stories, and end with practical fixes. What hurts most for you guys right now in health insurance? 1, for cost, 2, for finding a provider, or 3, for insurance red tape? That's insanity, Shannon. So guys, in the chat, is cost the biggest thing hurting you? Finding a provider in network, or getting insurance red tape? 1, 2, or 3 in the chat, guys. So you're 1 and 3. Layla, so you're going to say cost 3, 3, 3, 3, 3. The red tape at Misty. So it's a little bit of something different for everybody. Is it? So some people it's fighting the insurance companies. Some people it's finding an insurance company. All right, we're going to talk about the money paradox. Pay more, get less. The first big paradox, we spend more per person than any other rich, developed nation, but we don't consistently get better results. Where does the money go? High prices for hospital stays, drug specialists, and tons of administrative overhead. Quick yes or no in the chat. Have you ever received a surprise medical bill that you thought insurance was covering? What up, Anna? Layla has. Shannon, yep. Meg, yep. Okay. So other countries spend less annually, but cover more, but yet cover everyone in their country. Does anybody know how they do that? Seven stitches? That's insanity. Anybody have any idea how other countries pay? You'd like to know how? Oh, well, let's get into that then, Layla. You are in the right room today. Good morning, Nana. We are discussing the inadequacies in U.S. healthcare versus other developed nations. There isn't just one universal healthcare model. Here are three common ones, simplified. We're going to call this topic models that cover everyone in plain English. Let's talk about it. Single payer healthcare. Again, I know native in here is from Canada, which is one of the biggest examples of single payer healthcare. Care is mostly private delivery. Multi-payer with tight regulation, i.e. Germany, Switzerland. So, multiple nonprofit or tightly regulated plans must cover standard benefits package people can choose among. National Health Service, i.e. the UK. Government funds and largely provides care. Carrot point of use is insurance supplemental coverage, but the big single payer, multi-payer, national Inc. The U.S. could learn the most from. When it comes to health insurance. Oh my lord. Does anybody have any idea which system they think we would learn best from or could benefit most from? Damn, did y'all fall back asleep? engage in the comments. Hi, baby. Okay. Well, Irene's honest. She said she doesn't have any idea. Does anyone have an opinion? Lizzie, good morning. Good morning, Lizzie. Today's topic, please feel free to read the pinned comment, guys, as you're coming in. Today's topic is why U.S. healthcare underperforms versus its peers and what kind of change can be made. I just got a piece of tobacco on my lip. Oh, nope, that was weed. That's a joint. Forgot about that. So the question to the room right now, guys, is out of the 3 country models that we've been discussing, single payer, i.e. Canada, multi-payer with tight restrictions, i.e. Germany, or National Health Service, i.e. UK, which of those 3 models do we believe the U.S. would benefit most from? I got you, Layla. I can repeat it. Good morning, Trish. And there's no right answer. This is just your opinion. Out of what you know about those 3 systems, what do you think the U.S. would benefit most from learning from? You don't know anything about it enough to comment? Well, then you're in the right place. Let's talk about some facts and some myths. I'm going to read you a statement. I want you guys to tell me if you believe that. Okay, so I can give you all 3 again. Single payer, which is i.e. Canada, government is the main insurer, care is mostly private delivery. Multi-payer with tight regulation, i.e. Germany, consists of multiple nonprofits or tightly regulated plans must cover a standard benefits package. People can choose among them. National Health Service, which is the UK, government funds and largely provides care. Care at point of use. So the common threads in all 3 of those are a guaranteed basic package, negotiated prices, and simpler billing. Add-on exists, i.e. private insurance supplemental coverage, but the base is universal. So which of those 3, i.e. Canada, Germany, Switzerland, or the UK, Which of those three do you think we could learn from? And I feel like there's no wrong answer. Seems we can learn from all of them in all honesty. Absolutely. Absolutely, Meg. Imagine if we take bits and pieces of all that would revolutionize healthcare. I'm seeing Layla. I'm loving that. Let me read you guys a statement. I want you guys to put in T if it's truth or F if it's false. Okay? Universal systems mean long waits for everything. Correct, Layla. It is false because there is no blanket statement that can be made, because the reality is that weights vary by country and procedure. Primary care access, lower cost barriers, tricky elective surgeries may wait, but urgent and cancer care is prioritized. In universal systems, you can't choose your doctor. Good morning, Haley. Haley Ann, what's up, boo? Layla says, Layla is correct, guys. Do you know that in many countries, not only can you use any GP, but most of them have more choices than the narrow US networks? Innovation dies in a universal payer system. True or false? Innovation dies in a single payer system. Layla's gonna say false, but not 100% sure. Does anybody else have an answer? True or false? Innovation dies in a single-payer healthcare system. Love says true. Ooh, we have a dissent in the room. Anybody else want to put their point out there? We have two opinions here. Good luck, Irene. Good luck. Good morning, Jennifer. Haley admittedly has no clue. I love you, Haley Ann. You're a dork. Good morning, good morning. So the answer is false. Actually, medical and pharmaceutical innovation is global. Other countries buy the exact same medicines and devices, often at negotiated lower prices. Did any of those surprise you guys? We are discussing the shortfalls in the United States healthcare system versus other developed nations. Just so y'all know. I bet it did. When I started looking into this surprised the shit out of me. I'm not gonna lie. All right, let's get a little more personal with our topics. Let's talk about outcomes people feel in real life. Life expectancy. The U.S. underperforms peers with bigger gaps for lower income. Maternal and infant health. Higher maternal mortality than most peers. Gaps by race are stark. So I want to touch on that for a minute. Maternal and infant health. Higher maternal mortality rate than most peers. Gaps by race are stark. What that means is that women of color have a much higher maternal mortality rate than white women do in this country. And that's a little crazy to me. That goes back to the topic that we touched on, how doctors are to women of color what cops are to men of color. Okay? Like that, it is 2025. Are we really still there? Like, this is beyond insane to me. Morning, Jenny. Morning, Sickest. Today's topic, guys, is pinned at the bottom. Please read it. Feel free to leave if you're not interested or don't want to listen. Also, please say hi when you come in. That's just my rule. Y'all know it. If you can't greet the host, you will be greeted to the door. Do not worry about interrupting me. I have a whole flow that can be interrupted to respond to comments. Hey, Jenny. Nice. What are we having? Give me 1 second, guys. I need to grab something. Oh, we're talking about breakfast and shit. I want a grilled ham and cheese for breakfast. That's what the fuck I want. Eggs, bacon with toast. Hell yeah, that sounds bomb though, bro. That's fancy. Breakfast is usually a fucking toaster strudel up in this bitch. To be fair, toaster strudels are bomb. Alright guys, so another part that I want to talk about is where we rank in chronic disease. So chronic disease is classified by the AMA as a disease that is ongoing, requiring care. Okay? Does anybody know an example of a chronic condition? COPD, absolutely. Trish, that's my kind of girl right there. Diabetes, yep. Jenny cooking breakfast and still the fucking star student in the class today. Loving it. Jenny's making y'all look bad. Welcome back, Kryptonite. Today's topic is pinned, guys. Bronchitis. Layla, yep, that chronic bronchitis is absolutely a condition. Brittany says, I know nothing about nothing. Oh, come on, Brittany. Quit playing. Today we're going to discuss U.S. healthcare and its underperformance in the United States. What up, Britt? Both Brittany's are in here now. Now you guys don't know which one of you I'm talking to. I know I'm weird. It's okay. Y'all still love me, though. Chronic heart disease, absolutely. That is 110% a chronic disorder. Asthma, yes. Oh, you didn't like that one? My little laugh. High rates of diabetes, heart disease, and obesity is a chronic disease as well. Drive costs, complications. According to the U.S., this is why our healthcare costs so much. Just watch. Is because heart disease, diabetes, and obesity raise the cost of healthcare in the United States. I want one of you guys to make that make sense to me today. Let's talk about mental health and addiction treatment in the United States. Demand is up, access is patchy, networks are thin, out-of-pocket costs are ridiculous. So, why are mental health and addiction treatments so hard to access if we have such an epidemic of mental health and addiction? Layla's getting real close. Do you know that an out-of-pocket, non-insured cost for a 30-day rehab stay can be upwards of $250,000? Why don't they want people getting better? A decent rehab where you have half a fucking chance of actually working a decent program and not just finding better plugs. Dead serious. $250,000. There we go, Layla. They profit more in the treatment than the cure. Hence the reason preventative care, copays and deductibles often deter screenings, early visits, and non-urgent matters in the U.S. How many of us have skipped an appointment because we just couldn't cover the copay? We just didn't have it. Jenny, Layla, your brother skips it all the time. His schizophrenia is horrible. You're very lucky, Trish. Not all doctors do that. Moon won't go for himself, but he'll go for his little girl. You've stopped even making appointments, Bells. And don't you work in the ER? You're a healthcare worker, if I'm not mistaken, correct, Slime? My bells? That is. You work in the ER, correct? Make that shit make sense, guys. That's... Yeah, the waiting lists are ridiculous for mental and addiction services. It's ridiculous. Yep, the emergency room is treated like a medical center, like a literal doctor's office. So let's talk about why prices are so high. Let's talk about why. Okay? Short version, we pay more for nearly everything. Hospital stays, imaging, specialist visits, and brand name drugs. Why? Price setting. Okay? Other countries negotiate or set national reference policies. We often let each hospital or insurer set and hide prices. Fragmentation. Thousands of plans and billing rules. Admin armies and waste. Market power. Okay, this is a big one. Big systems can charge more. Patients rarely get to see real prices up front. Drug pricing. Most other countries negotiate nationally. Medicare only got limited negotiation authority. Private plans vary a ton. Would transparent upfront pricing change how you guys shopped for care? That's insane. Bells. That's fucking insane. Okay, Miss Kryptonite. Good. And how many times have you heard, but don't other countries pay a higher tax to cover their insurance? Yes. Somehow, but households there don't pay premium, deductibles, or surprise bills on top of taxes. In the U.S., many pay taxes, premium, deductibles, and co-insurance. And employers pay that too. It's part of your compensation. Imagine swapping your premium deductible typical out-of-pocket expenses for a predictable tax-like amount and cap drug prices. Would that make you feel better or worse? If you could take all that we pay premium deductible and your out-of-pocket expenses and swap that for a predictable tax-like amount and capped drug prices, would that make you feel better? For Layla, that's an immediate yes. I've got the worst headache. Love you, Trish. Paying your premium, your deductible, and your out-of-pocket expenses, plus whatever surprise bills you get. Would you feel better if you could swap it out for a very predictable tax-like percentage and being capped on drug prices, which means that they charge so much more. There you go. He's asleep. Where I'm going to go back to after this conversation. I've got the worst headache right now. Good morning, Allie. Welcome back, Jennifer. Oh, my stomach started turning. I don't know why. My sinuses. It could be just the amount of Bloom energy drinks I've been drinking too, so I should probably stop that real quick. Right. What actually works elsewhere? Let's talk about that. Here are some features countries use that we could adopt more broadly. Guaranteed options, telehealth, and same or next day slots. National or regional price negotiation for hospitals and drugs. Simple universal coverage card, no network gaming for basic care. Serious investment in maternal health, home visits, and midwives. Bundle payments that rewards outcome, not volume. Data transparency so patients can compare outcomes and prices. Here's how you can push for better starting this week. Know your benefits. Learn what preventative care is. $0 for you. Use cost tools. Call ahead for cash prices. Many hospitals have to tell you what they are. Support policies that expand primary care, capping drug prices, and simplified billing. Share your story with local reps, patient groups. Stories move policy. Mutual aid. If you found a fair price clinic, pharmacy program, or sliding scale therapist, put it on your page, your local Facebook page. Tell people about it. Share it. So you guys, if this was helpful to you today, just let you guys know I'm going to try to get a list of resources up on my page. I'm going to do a quick video of like national resources. I am not feeling well. I'm going to lay back down.